Hey everyone, welcome back to the sessions. We have Jacques-Henri Veyron with Présage. He's going to speak to us today about AI-driven home healthcare for early detection and the management of elderly health conditions.
Thank you, Alex, and hi everyone. So I'm Jack. I'm very glad to have this conversation with you, and I'm more than excited to be able to discuss with you all after my presentation. Just a bit of myself. So I'm an engineer, modelization specialized, and then I spent 10 years in consultancy, and then 10 years in French Ministry of Health. And a few years ago, I established Présage, this company. We are going to discuss one of our products, which is called Présage Care, in a minute. So I will just share my screen, and I'll be able to start. So now I think everybody can see my screen. Okay, so if you have any question after the meeting, please feel free to send me an email, and I will be more than happy to answer it. What we did in Présage is to try to find a solution on a very well-known topic, which is the fact that we have a huge number of seniors which is going to arrive between now and 2050. At the moment, we have more than 750 million seniors, but we know that this figure is going to double by 2050. And more than that, a huge majority of the seniors will be in countries with lower middle income countries, which will raise new issues. In addition to that, we know the seniors, especially the one of more than 75, so the elderly, they have higher consumption in terms of primary care. And the primary care system is under tension in a large number of countries. Here in Europe, in the US, this is something which is quite well known. And one of the the traditional approach, which has been developed by the WHO, is to develop digital technologies for health. If you go on Apple Store or Google Play, you will find something like 450,000 solutions, devices who can help people. But the huge issue we have is that elderlies, they don't really use digital technologies. After 80 years old, 80% of them are not able to use on a daily basis an application, which means one of the solution which is proposed to support healthcare is not adapted for seniors. When I mean senior, I mean more than 75 years old. The third issue we face is what we call the iatrogenic disease linked to hospitalization. This is very simple to understand. For people of my age, and I would say till 70 years old, going to hospital is always a good news. It is a place where they are going to have the high level of medical staff and nurses, and this is a place where it's always a good choice to go. After 75 years, because of geriatrics issues, the fact elderly goes to hospital might be not so good news. It is quite well known, and I put you one of the publication you can find. Um,